Next, we have Kevin Frame from on Zoom. Okay, we can come back to Kevin if we know he's back on with us. Alethea Mashar.
Hello, my name is Alethea Mashar. I live in Montmorency County. My 17-year-old son is on the children's waiver. The Honorable Christine Morse, Chair of the Appropriations Committee and members of the subcommittee. 6 years ago, when our son was selected to receive the children's waiver, we believed we would finally get the help he needed after years of living with severe behaviors. His first behaviors started at the age of 3, around the time he started treatment for leukemia. In the time since he's been on the children's waiver, we've accessed community mental health crisis services on numerous occasions, gone to the emergency department as directed in this community mental health crisis plan, had the police called to our home, both by us and by CMH crisis staff, who was terrified by my son's behavior and completely unable to de-escalate him. He's also injured himself, me, and my husband, including broken bones and causing post-surgical complications that have required another surgery for my husband. He's damaged much of our property. His diagnoses are Down syndrome, autism, ADHD, schizoaffective disorder, bipolar type. His intellectual disability is severe. His behavior is severe. His medical needs are complex. My parents, on multiple occasions, have strongly suggested that we relinquish our parental rights because it's the only way they can see that we can get our child the help he needs. In our family, 2 emergency room doctors and a psychiatrist have recommended that we take our child to a large children's hospital emergency room, preferably University of Michigan, and leave him there at the hospital so that they would be obligated to give him the care he needs in our absence. That is seen by our family as the only way to get our child the help he needs. He's been in the University of Michigan Child and Adolescent Psych subunit, a 3-bed subunit. That's the only hospital in the state that can care for him. Right now, their wait list for him to get back in there is well over 6 months. And he's having severe behaviors, delusions, hallucinations on a daily basis. Our community mental health clinical leadership team recently denied our son a referral to DART, which is a program that has an on-site autism care program. A referral that was recommended by the University of Michigan psychiatry team and by their own psychologist. They denied it because he hasn't had enough failed hospitalizations, even though there's only 3 beds in the state that can manage his care. Meanwhile, my husband and myself are managing his care by ourselves daily. He requires hands-on support with all of his activities of daily living, including intermittent catheters for urine, briefs for bowel incontinence, a daily bowel cleanse, and all of his hygiene needs. He often refuses that care, leaving him not hygienic as he should be. We've exhausted all of the options that we have for therapies. We have one person who is able to work with him, a 60-year-old woman who plans to retire later this year. My request is that you allocate resources to keep our child safe at home. or allocate resources for a safe place for him, a structured, safe environment before he reaches adulthood in less than a year. We waited 14 years for real help that we thought was coming 6 years ago when he received the children's waiver. It is not there. There is no programming for children with severe intellectual disability and severe behaviors.
Thank you, Alethea. Thank you for sharing your life experience.